Yeah, we've just done some drawings. We've drawn different places like house. There's a healthy house where we have every year we have a milad where ladies come. We can communicate there, tell them about cooking, healthy eating, how to look after the family. We've got school where kids go, like back here, yeah, and children's centres. We've got ASDA. They've got loads of posters and everything at the moment. Community resources boards on Burgess Field. There's mosque, and we've got like faith leaders, community engagement team, which they can help each other. We made a big roundabout that they're going everywhere, all around the community. Not something.
We've called it the roundabout of information, community information roundabout, so you can off stake of whatever's culturally relevant to yourself. For somebody obviously it might be shopping, for somebody it might be like going to the library, post office, schools, so all the community kind of different venues that people use. This is probably something more specific towards high field then, which people use and play on the field, so you can make it specific to each different area. Then if you look at like faith leaders, so you can get faith leaders involved, then they can make it more relevant to that audience specifically, meaning exactly what it has, what relevance, health and, for example, diabetes and looking after your health, and how obligatory it is, for example, for Muslims themselves to look after your health. Then if you look at Senior Show, the way the community health team, we've got the diabetes team, they're all different partners that you could use who are already using community health champions already, so we can use some of their models to kind of disseminate the information into the different kind of communities. So if you're looking at the tower block, you can see each person's climbing up the ladder, so depending on how healthy you are, the top guy obviously feels like he's on top of the world, so each person's climbing to different rungs of the ladder, so making them feel different. So slowly but surely you'll get to the top, so you can see people trying to climb up through the different kind of means. That's us.
We want to do an awareness week, so we're trying to raise as much awareness as we can for diabetics and diabetic eye problems. So instead of just having an awareness week and not planning for it, we thought we'd have quite a lot of planning involved before we run the awareness week. So trying to get GP surgeries, opticians, pharmacists, all health professionals together, including all sorts of staff that work in these surgeries, getting them not up to scratch, but getting them involved as to why we're doing this awareness week. It's important for diabetics to get their eyes checked as well as eat healthily. And all the other things that go with it. Patient participation groups, so getting them involved. So that people who suffer from diabetes, I think we've found it's quite powerful to get them involved in these awareness weeks, because when it comes first hand from somebody's mouth to another diabetic, it tends to be a lot more powerful. They tend to realise that well, he's diabetic, and he's had problems, and it can make a difference. And there are diabetics that have been through an expert program, so I don't know much about that, but was it diabetics that have been through a program where they're able to draw on their own experiences and then sort of try and help other diabetics, other professionals. The awareness week itself, so getting professional staff involved, these experts involved, patients who've had first-hand experience, health trainers, and the thought was to try and get have a finger prick test within these practices, so pharmacists, opticians, where even non-diabetics are trying to explain the importance of getting checked, and not only getting checked, but if there are friends who are diabetic, explain the problems to them so they can actually talk to the family or relatives that are diabetic. Promote retinal screening, and also get involved with the Action for Blind bus, so have some sort of bus involved with this awareness week. And once we've done the awareness week, trying to not just stop there, but trying to feed people who have been or inquired about the awareness week or had experience within the awareness week, feeding off that into opticians, Keithley Health, Healthy Living, GP nurses, podiatrists, Sight Airedale, retinal screening, so we sort of move people forward into relevant areas. Have I missed anything?
No, the bus was going around different practices, you see.
Yeah, that was it. Different GP practices.
And stuff to make it an enjoyable week and experience.
Yes.
Consummate PR professional that I am, the first thing that I really wanted was a communication strategy and action plan associated with it. I think a lot of the things that would go in there you've got already, your aims, your objectives, the messages. What we need to identify is who are all the target audiences and what kind of resources we're going to need that are most effective for those different target audiences. We'd also need to look about at the very end of all this, how are we going to measure the impact and the outcomes? You know, we could, for instance, do market research if we had lots of spare cash, but we can also look at increasing uptake of services, people who've attended their appointments instead of failing to attend. So that would be the idea of the strategy, that it sort of gets onto paper what we want to do and how we want to do it. Then we went on to looking at some of the ways that we might want to address some of the target audiences that we'd identified, and we've only identified a few at the moment. They were children, patients, relatives, staff, health and social care professionals generally, younger people, and I think we'd put in there older people as well. So particularly for the younger people's market, we've got things like phone apps, all the rage with your iPhone tapping onto an app and getting lots of information about whatever it is you need to know. We talked about having a comic book type storyboard, particularly for people who might not otherwise be able to read information in any language. We talked about making a DVD. And somebody said we ought to do it Bollywood style. Again, probably for younger people and silver surfers, we've got all the social media, the Facebooks, the Twitter, YouTube. We could put DVD on YouTube, and we could have a DVD to hand out to people who might not otherwise read leaflets. We talked a lot as well about language and about having appropriate languages, not just translated languages. We thought we could do a project through schools and madrasas in the same way that the oral health project had been done. We talked about some products as well, for example, jigsaws. We started on playing cards because there'd been some successful playing cards done for another project, but we were told that they weren't sort of culturally acceptable in some cases, so we thought maybe something like jigsaws or some other product of that nature, something that just got people playing with information and taking it in. We also thought about some kind of product that would simulate what your site would be like if you had early onset of diabetic retinopathy. Just something to give out, you know, and you could be looking through it and thinking, that's what it looks like, this is what it looks like now, so now you see it, now you don't. But it would give people more of an idea of what they were looking for. We talked about radio phone-ins, health slots on Sunrise Radio. We talked about use of Radio Ramadan. We thought about doing a campaign, a healthy living campaign through the pharmacies, opticians and dentists in Keighley, which is very much along the lines that the group over there were doing. And we also talked about buying an advertising campaign on Ramadan and Sunrise Radios, Radio Ramadan, Sunrise Radios. Lots of other things we could have gone into, but that's where we got to.